Hello and welcome. Today, we're going to demystify gynecological health. It's such a fundamental part of our overall well being, and really truly understanding it is one of the most empowering things you can do for yourself. So let's get right into it.
So to kick things off, let's just pause and think about this question. We hear the term reproductive health thrown around a lot, right? But what does it actually mean? Well, it's so much more than just a clinical term. It's about your body, your choices, and your future.
Okay, so at its core, gynecology is really just specialized healthcare. It's focused entirely on the female reproductive system. The whole point is to provide routine, preventative care, and of course, to treat any issues that might pop up. It's a field dedicated to a part of the body that changes so much throughout our lives.
So, why is this routine care so incredibly important? Well, think of it as being proactive instead of reactive with your health. Regular checkups can actually prevent future illness. They can catch really serious things like cancer when they're most treatable and detect infections early on. It's all about preserving your options for the future, whether that involves having kids or just staying healthy long term. It's really preventative medicine at its best. To really take charge of your health, the absolute first step is knowing your own body. So, let's do that. We're going to take a quick tour of the female reproductive system, and we'll start from the outside and work our way in.
Okay, so what we're looking at here is the external anatomy. The proper term for everything on the outside is the vulva. That includes the labia, the clitoris, and the vaginal opening. It has two main jobs. First, to protect all the internal organs from infection, and second, to play a key role in sexual pleasure.
All right, moving inside now. This diagram shows us all the key players of the internal system. We've got the vagina, the uterus, which is where a fetus develops, the fallopian tubes, where fertilization often happens, and of course the ovaries. Every single part here has a super specific and really important job to do. Now let's zoom in on the ovaries for a second. These are small, but they are mighty. They have two massive jobs. First, they store and release the eggs that are needed for reproduction. And second, they're like little hormone factories, pumping out the estrogen and progesterone that regulate your menstrual cycle and support a healthy pregnancy. Okay, we've covered the basics of the what. So now let's talk about the how, the exam itself. I know, for so many people, this can be a huge source of anxiety. But honestly, knowing exactly what to expect can make a world of difference. First things first, your comfort and safety are the absolute top priorities. Before anything even begins, your doctor or nurse should explain the whole procedure to you. You'll get privacy to change, there will be a chaperone present, and the whole environment is designed to be as warm, comfortable, and respectful as possible. The pelvic exam itself can basically be broken down into three main parts. First, the provider will gently press on your abdomen. Second is the speculum exam, which lets them get a look at your cervix. And third is something called the bimanual exam to check on the internal organs. Let's zoom in on those last two steps. Okay, this is often the part that people worry about the most, the speculum exam. This little instrument is gently inserted and it's open just enough so the provider can get a clear view of your cervix, which is the opening to the uterus. This visual check is a really, really important part of preventative care. So, with that clear view, what are they looking for? Well, they're checking for any signs of abnormalities, things like unusual discharge, growths, or any bleeding. This is also the moment when a Pap test is done. It's just a quick swab to collect some cells for cervical cancer screening. It literally takes a few seconds, but it is an incredibly important screening tool. And the final step is the bimanual exam. For this, the provider uses one hand on your abdomen and a couple of fingers inside the vagina. This lets them physically feel the uterus and ovaries to check their size, shape, and position. It helps them find any tenderness or issues that you just can't see with your eyes. So, why are these exams so vital? Why go through all this? Well, let's look at a specific condition to see just how important this kind of care can be. We're going to talk about something called pelvic organ prolapse. So, what is pelvic organ prolapse? Imagine the muscles and tissues in your pelvis are like a hammock, holding up all your organs. Prolapse is what happens when that hammock gets weak. When that support gives way, one or more of those organs, like your bladder, uterus, or rectum, can actually drop or press into the vagina. This side-by-side visual makes it crystal clear. On the left, you see all the organs in their normal position, held up nice and snug by those pelvic floor muscles. But then, on the right, you can see what happens in a uterine prolapse. That support is gone, and the uterus has descended downward. And as you can probably imagine, the symptoms can really affect a person's quality of life.
It can be anything from a feeling of pressure or a bulge to issues with urination or bowel movements to a persistent backache. It can get in the way of daily activities and even sexual function, which is exactly why recognizing these signs is so crucial for getting help. Okay, now let's zoom out for a minute. Understanding our own bodies and getting care is, of course, deeply personal, but it's also connected to a much, much bigger picture, public health and even national policy. So what you're looking at here is the cover of Kenya's National Reproductive Health Policy. Now, documents like this are so important because they create an official framework. They represent a government's promise to make sure that healthcare is available, accessible, and high quality for all of its citizens. And at the very heart of a policy like that is this powerful statement. It frames reproductive health not just as a medical thing, but as a basic human right. The right to make your own informed choices about your body and your family, and to have the information you need to make those choices. So, when you boil it down, what are these policies actually trying to do? The goals are pretty clear. Make sure everyone can get care, make that care better and more efficient, and achieve huge public health wins, like bringing down maternal mortality rates. So, here's the big takeaway. Taking care of your gynecological health is a personal journey, for sure, but you are not alone in it. It's a powerful act of advocating for yourself, and it's backed up by a global commitment to seeing health as a fundamental human right. And that brings us to the end. I want to leave you with this question to think about. What's one small, manageable step you can take today to advocate for your own health? It could be scheduling that checkup you've been putting off, reading one more article, or even just talking to a friend. Thanks so much for joining me.